In this lecture, we're going to review some of the basic definitions and classification systems for various joints in the body. And there are two general classification schemes, one based on the function of the joint and the other one on the structural elements of the joint. But both are essentially classified based upon how much movement is allowed by that joint. And when we look at the first classification, which is based on the function of the joint, the first one here is a synostosis, and these refer to joints that are fused, so two or more bones that have come together and form a fusion of those bones, and those are joints that are considered to be immobile. And in this particular situation, the joint can be considered normal or abnormal. So in some instances, in pathological instances, bones that would normally allow a little bit of movement would undergo a pathological fusion where more bone tissue is added and that joint becomes immobile. Synostoses are joints that are one step up, that are relatively immobile, which means that these joints have a very small or almost imperceptible amount of motion. And two examples of that include the cranial sutures and gomphoses, which are the joints between the teeth and the maxilla or the mandible bones. Amphiarthroses, moving up one stage of motion. These are joints that are slightly mobile, so these are joints that permit a little bit more mobility than synarthroses. And one example here is the syndesmosis, or syndesmoses for plural, that we'll see an example of here on the next slide. Diarthroses are the most mobile of our joints that we typically find in our extremities. The second classification is one based on structure. And so when we take a look at quote-unquote a bony type of joint, these refer to the cranial bone connections much later in adult years. And so as humans age well into their adulthood, the connections between the cranial bones start to lose that little bit of mobility that those bones had, particularly during the childhood or adolescent years. Fibrous joints are named according to the fibrous connection of the connective tissue holding those bones together. And some examples here include the sutures of the cranial bones, particularly during the younger years, syndesmoses and gomphoses. Cartilaginous joints, the two examples that we'll see here shortly, include synchondroses and symphyses. And the synovial joint we'll cover on the next video. So if we take a look at fibrous joints, and we see three examples of what we would call fibrous joints. The first example here on the far left is the cranial suture. And so here we have what's considered to be dense fibrous connective tissue holding the cranial bones together, but in later adult years these connections start to permit less and less mobility, and of course these joints are certainly a little bit more mobile in early years, childhood and adolescence. The next example here is the syndesmosis, or syndesmoses for plural, and the one example here is the inferior tibiofibular syndesmosis. And so this is the joint on the inferior side of the inferior portion of the lower leg between the tibia and the fibula, and it exists as this broad sheet-like connection of these fibrous connective tissues that span the length of the lower leg. And the function of these is to essentially prevent separation of the tibia and the fibula, but it's not immobile. So this connective tissue does allow a little bit of separation, and that's going to be necessary for the ankle and foot to go through motion, but we don't want too much separation here. The gomphosis joint here is formed between the teeth, in this case the tooth, and the maxilla or mandible bones, and that connection is formed by fibrous connective tissue you see deep within the joint of the tooth, sitting inside the bone of the maxilla or the mandible. Cartilaginous joints, there are two types here, and as highlighted at the very bottom of the slide, here you see the pubic symphysis, which we'll talk a little bit more about here. And the pubic symphysis just refers to the joint on the anterior inferior side of the two pelvic bones that is connected by a fibrocartilaginous disc. The second type here is you see the connection in the rib cage, or rather the connection between the ribs and the sternum, as well as the clavicle and the sternum. So the cartilaginous joints are characterized by the connection of the bones by cartilage, and are also characterized by the fact that there is no joint cavity forming these joints. And of the two types, the synchondroses are bones that are connected by hyaline cartilage directly, and that's what we see between the clavicle, and that's what we see between the ribs and the sternum. The symphyses refer to hyaline cartilage that covers articulating surfaces, and there's an intervening pad of fibrocartilage, and that's what we see on the bottom right hand corner of the pubic symphysis. And these joints tend to be strong, which means that these joints are effective at maintaining the connection between the two bones, yet are flexible enough so as to allow enough motion so that the pelvic bones can rotate to correspond to leg motion. So this ends this video on joints and classifications.